Very few people know that there are 3 secrets to stopping knee pain, and this can even work with arthritis.
That's right. Believe it or not, there are 2 secrets to how you walk that can change your knee pain significantly, as well as some strengthening exercises in your hips that we're going to show you as well.
The most common mistake people make with their knees when standing is locking them out straight like this, or even with walking is locking them like this with a heel strike pattern. What problems can this cause, Brad?
Well, it's interesting you mentioned that, Mike, because I'm going to tell you. Why don't you just go back to standing with locking knees? This is something most people are completely unaware of. Their habit is to stand with fully locked knees, putting the knee at end range, and that really could beat up the cartilage and advance arthritic problems. So a slight bend in the knee is very helpful when you're just standing, like doing the dishes, that type of thing. And now when you walk and you heel strike and you put your foot in front of you, that force goes through the heel all the way through the joint into the knee joint. So there's that little bang, bang, bang every time that heel hits. It continues to put stress and impact forces on the knee, the hip, and even the back. So we're going to show you how to eliminate that. So we're going to go through in detail, step by step, how to change your walking. Now, Mike has his foot out, heel striking like most people walk. Again, having that problem I just discussed. So we need to actually land on our forefoot instead of the heel, and instead of reaching way out in front, you actually foot contact below the hips or straight below the body. Mike, can you be a little more explicit on that?
So, most people when they walk, they step out in front of them like this and they are striking on their heel. This is really disengaging your glutes. To take stress off of your knees when walking, you want to engage your glutes much more. To do that, first thing you're going to have to do is shorten your step length. This is very long. You're going to take a smaller step like this. This becomes more natural. Notice as I'm stepping and going forward, my body stays over my hips. When I'm stepping like this, following through, this is when your butt muscles are going to engage properly. If I'm walking with the heel strike way up here like this, then coming and lifting up, I'm barely getting hip extension before I'm swinging through again, making your hip flexors work more and your knee joint having to absorb more of that stress.
Wait, Mike, I just want to bring this out. Just like you had referring to, go to the forefoot strike, the proper. Look at the knee is actually flexed now when the forefoot comes into contact with the floor. Things have give here, there's give here. The shock of foot strike is actually absorbed, and your joints do not have to absorb that banging that you did with the heel strike.
So to try this out, do it in your house first. Walk around in stocking socks or barefoot if you can, or slippers. Some type of flat shoe footwear is also acceptable. Start walking with your normal pattern like you always do if you're a heel striker, and place your hands on your butt. Now, try to land on your forefoot and feel your butt engaging more. You should notice your glute muscles engaging properly with walking. If they're not firing right, we do have an exercise we'll show you how to strengthen them and get them firing more.
So he means they're going to contract. Firing, that's a PT thing, isn't it?
Fire away.
All right, now we're going to show you 2 critical hip strengthening exercises that are going to complement the actual walking on your forefoot as we just demonstrated. Mike, go ahead, show the first one.
The next exercise, we're going to start in a kneeling position on your elbows like this. Brad will show a standing version next. To perform this exercise, I'm going to bend my knee to 90 degrees and lift it towards the ceiling. I'm not going to go all the way up like this and all the way down. We're going to pick somewhere in between and do little oscillation movements. I'm going to shoot for 30 repetitions and make sure you're firing from the butt muscles, not the hamstrings. To engage the butt more, simply turn your leg like this, and then this will help engage the glutes more. Do 30 repetitions on one side, and then you're going to switch and perform it on the other side as well. If this starts to become easy, you can certainly throw a cuff weight of sorts underneath your thigh here, and that'll add some more resistance.
All right, now Mike was actually doing it on the table. It's probably you can do it on your bed, but preferably on a carpeted floor. A firm surface works with best for you. But if you're unable to go on your hands and knees like that, this is a good option. You can put your hands like this on a cupboard or a firm table or forearms. I'm going to go like this. It's most comfortable for me at this level. Bend the knee 90 degrees here. Bring it up. And just like Mike mentioned, we're going to get the mid-range, not way up high or down in here. So that mid-range, and work your 30 repetitions. And the same thing that Mike mentioned, to actually get more focus on that glute maximus, rotate your heel down like this and then work it. And you should feel this muscle start to burn, and you know you're doing good isolation of that glute max. All right, the next hip exercise, we're going to focus on the glute medius, which is on the side, good for stabilizing of the hips. You stand up with your feet about shoulder width apart, toes pointed forward. Good, tall, straight spine and posture is what I'm talking about. And we're going to do the right hip first, 15 repetitions. Do not let your toe point out like this. That is a natural thing for the body to do for many people, including myself. So toe straight forward. Mike's demonstrating with some resistance using a band. You want to start out without the band to make sure you get the mechanics proper until you strengthen that muscle. You'll be surprised. You'll feel that muscle right here start to burn if you do them slow with good, meaningful movement. Don't let it touch the ground between each repetition. And don't do this. This will absolutely negate any of the benefits. Tall and out like this. So you can do 15 on this leg. Make sure you do 15 on the other leg. And you're going to build up and then relax a little bit and do up to 3 sets of 15 on each leg. Mike, do you have something to add on that?
A couple cues to keep in mind. The knee that is staying stationary, I have a slight bend. I am not locking it out. This will engage the quad muscles a little more. Also, like Brad said, I'm not leaning over. You want this to be upright posture. I'm working this hip abductor standing upright, as well as this one kicking out. Notice also too, I'm not kicking out as high as I can. I'm keeping it about a half an inch off the ground and just going sideways what I comfortably can. And to get more resistance with the band, just flex the arms more, or you can use a loop band like Brad has as well as an option.
Right. These loop bands work really nice, easy to hold, and it's exactly the same thing. Now, if you're having problems with balance, simply go up by the wall, hand on the wall, and there you go. You got good stability. Plus, it prevents you from leaning without that compensation that Mike talked about. All right, what do you say, Mike?
We got one more thing for you, but it's a stretch. Secret bonus tip.
All right, we're going to add a bonus stretch. Now, this stretch is for people who have tight hip flexors. In other words, the muscles in the hip here and the rectus femoris that goes down to the kneecap. If it's tight, it puts excess pressure on that kneecap, creating knee pain. Go ahead, Mike. Show them how it's done.
So you're going to need a taller surface. You can possibly use your bed or a table, whatever you're comfortable on. You're going to need start laying on your back. Bring your buttock towards the edge of the mat or table. The further you are to the edge, the more stretch you will feel. Begin with both knees to chest like this. This should feel good for your back. Now I'm going to remain my right leg up, drop my left leg down. After I go down, I'm keeping in a straight line. I'm not going out like this, nice and straight. And then I'm going to try to bend my knee and bring my heel towards the table here. You might feel some cramping or stretching in your hamstring area. Just do what's comfortable for you. Hold this for 30 seconds. Notice when I'm doing this, if I'm not engaging my right leg here, my hips will just drop. Make sure that knee is up, and this will stretch this even more. After 30 seconds, you're going to reset both knees to chest, switch sides, and do 30 seconds on this side. Perform this 2 to 3 times a day. If you notice one side is tighter than the other, do an extra set on that side.
I also want to just mention, if you're doing it on your bed and the edge of the bed feels like it's too soft and going down, you can simply put a pillow underneath your bottom side, and that can be real helpful. All right, so I think the biggest takeaway from this video is actually that first intro when we talked about changing your walking pattern and standing, not standing with locked out knees. And for me anyways, changing my walking pattern to 4-foot walking is the biggest thing. And if I walk without shoes on in the house, that really helps me out a lot. So just a little hint from my perspective. What do you say, Mike?
If you want to check out more videos on how to treat your knee pain, we have another one right here that you can click on.
Excellent job. Good luck. Walk away.
Bob and Brad, the two most famous physicians. physical therapist on the internet.